With Marie-France LeBlanc of North End Community Health Center. How are you today?
Fine, thank you. Hi.
Hi. Could you please tell us a little bit more about the North End Community Health Center, your services, and the community that you serve?
The North End Community Health Center is an organization that was started 50 years ago, almost 51 years ago. And it was started by three physicians, female physicians, who felt that there was a real need to bring healthcare, primary healthcare in particular, to the community. And the community was an area in the north end of the city that was particularly poor and experiencing a lot of homelessness. So they opened up a storefront kind of clinic, moved around a few times, and today that clinic has over 85 people in it. And we have a primary health care clinic, which is what they initially started with, but they really built the first collaborative framework for a primary health care clinic in Nova Scotia. So our clinic also has a dietitian, social work, nurses, nurse practitioners. We support all of our community with residents and with occupational therapy. You name it, we've got it. It's a great collaborative practice. That clinic also grew into providing an outreach program, which we call MOSH, which is the Mobile Outreach Street Health Program, which started about 12 years ago. And right before COVID, we were lucky to get a mobile outreach van, which is really a mobile clinic. So we support all of the shelters in the city, the camping sites, the anyone living or experiencing homelessness in HRM. So when we first started, we really only serviced the North End, but now we provide supports for all of HRM. And we have a free dental program that runs 5 days a week. We also provide the Housing First program, where we support over 100 individuals to remain housed. In the last little bit, we've also started a scattered site managed alcohol program that was started at need during the pandemic, but is now a full program that supports individuals throughout the community. I believe we were the first scattered site program in Canada. I believe there's a couple of them now based on our model. So that's something that we're very proud of. As well, we have a pause mental health walk-in clinic that runs 3 days a week. And yeah, I think that is what we do. We also have several buildings that we support either through master leases or through ownership to provide affordable housing for individuals in our community. And the houses that we support are mainly for people with high acuity who are experiencing homelessness. And then finally, in the fall, we will be launching our new program, which we call the Overlook, which is a supportive housing program for super high acuity people experiencing mental health and addiction problems. And that will house 60 people, 24/7 support, nurse-led harm reduction-based program. So nurses, OTs, doctors support, intensive case management, and mental health and addiction counseling. So we're excited about that.
That's very, very exciting. Super needed. I definitely would like to have more conversations about that in the future. Do you see any gaps in terms of individuals or groups that don't have access to supports and would really benefit from the access to a community health center, either in Nova Scotia as a whole or more Halifax specific?
Well, I think Nova Scotia as a whole is very young in the community health world. We've been around for 51 years, but we're sort of the lone wolves that have been around for that long in this and successful and who have grown. And that's because we're in the urban center, I would guess. There are other community health centers that have been around for some time. However, their ability to grow in the true community health center model hasn't been as successful. So I believe there's a lot of need for this kind of a model. Now, we have other models in our province that have been very successful. We have a model in the South Shore in Clare, which is municipally supported. So the municipality provides the building and the municipality provides funding for core staff, which is an amazing thing. And the community, it's thriving. They have a great collaborative practice and lots of doctors, nurses. So the need is there, and that's wonderful for them. But then we have so many other areas that are struggling to keep a doctor half a day a week. So in Nova Scotia, everything looks different because we're very rural in a lot of ways. But Cape Breton, so actually Sydney, Cape Breton, and Halifax, which is really HRM, Halifax, Dartmouth, and surrounding areas, are really, really having a strong, um, have a lot of homelessness right now, a lot of people experiencing homelessness. And our programs are all not-for-profit based. We do receive some funding from the government, but it's all primary care based. And we receive some money from social services as well, but it's not coordinated and there is no core funding. So there's a real need to do that so that we can expand our programs, so that we can expand our programs to Dartmouth. That we go there, but we don't have a hefty presence there. To other areas, similarly to Cape Breton. It is getting better. Cape Breton just received a safe injection site, funding for their safe injection site. So piecemeal, we are getting a lot of services, but there's no concerted effort and no coordinated effort in order to really have an impact and say, okay, this is what's needed. This is part of the solution. How do we do that?
Understood. The pandemic was a very difficult time for many community health centers to adapt and continue to meet the needs of their clients, although I continue to speak to community health centers who have managed to do that and persevere. Can you speak specifically to the impact that North End Community Health Center made during the past 2.5 years of the pandemic?
Well, the pandemic really allowed my team to shine. And by that, I mean, they were allowed to be seen. They did everything that they've always been doing. However, in a crisis situation, everyone turned to us for our expertise and how to continue to support this community. So all of the nimbleness and the ability to pivot and the ability to adapt to all of these things, which is what they do on a daily basis. Because as you know, with the community that we serve, you have to be able to adapt. You have to be able to think out of the box. So this just allowed us to continue to do that. So we were very involved, not only in supporting isolation sites and supporting pop-up shelters, in supporting those living on the street, but we were also instrumental in providing testing, in providing inoculations, and as well as in going in and supporting when there were outbreaks. We had outbreaks in various communities that were not only hard to reach, but they were very skeptical of traditional methods. So, we went out there and we helped make the community more comfortable with the idea of being vaccinated. So we were incredibly busy. We never really closed. We also continued to see people in person. One of the key things was that we know that our community can get very isolated, and that is really not good for them. So our physicians, our nurses, our outreach workers found ways to continue to see people in person, not through Zoom. Even though technology might have been available, we distributed an enormous amount of technology, at phones, at tablets, in order for people to be able to continue to be connected. But we also did parking lot clinics. We used our mobile van. We went and saw people in parks. Whatever was needed to keep the connections going, we did that. Similarly, we became very involved in providing food to those who needed the food, whether it was delivering frozen meals, fresh fruit, fresh vegetables, through our good food box programs, through our pantry program, hot meals every night, distributing gift cards so that people could go out and get their own meals. You name it, we did it. So we were incredibly involved, and I would say that that for us, we would have wanted to be able to do more. That was the stressful part of it, but we did feel that we did a good job of keeping COVID at bay in the shelter community and in the homelessness community, and in providing the proper information to our community that was very skeptical about the COVID and the vaccination programs.
Wonderful. North End Community Health Center operates a number of services and programs that we've touched on a little bit that focus on people's determinants of health that go beyond just healthcare, like food securities, early year support, upstream supports, etc. And you've already touched on some of the things, you know, that Halifax region and Nova Scotia could use with more community health center supports. But I just wanted to give another opportunity for you to name if you saw any particular areas where increased federal investment in community health centers or even provincial would enable you to increase your reach and further improve health and well-being in your community.
Well, I think that with our 51 years almost of experience, we have a really good template for community health centers and for its ability to impact the communities that we serve. And we're the only ones in HRM, and I think that we really need to increase that. So whether it's providing more funding for us to be able to increase our reach, or it's the ability to, I really feel that that's probably the best approach, just because we have the ability to do it, we have the know-how, we have the resources, and we have the trust. We have the trust of the people that need to access the services, no matter where they are in HRM. We just don't have enough people to do it. We don't have enough infrastructure to do it. So for me, the investment really needs to be in infrastructure and in people. And for us to work with, so that we can work with more and more communities to bring our services and our way of servicing people to those communities that desperately need it in a time when there's such a shortage of physicians. In particular in Nova Scotia, we have a huge shortage of physicians. Community health centers can fill that gap. They can't completely fill it, but they can sort of fill part of it. And I think that we need to be able to do that in other communities across the province. And interestingly enough, in our province, you know, there's a lot of emphasis being put on primary care clinics that are run by our health authority. I think there's a lot of value in that, but there's no nimbleness in that, and there's no ability to turn on a dime or to hear what the community really needs and adapt. And I think that that is particular when you're dealing with some of the marginalized communities that we support, is really, really important. So I think that providing us with more infrastructure, providing us with more people so that we can use our model and spread it across HRM for us, but for others to spread it across the region, is something that would be super valuable.
100%. I want to congratulate you again on the overlook, and I'm excited to have more conversations about that moving forward. And I want to thank you again for your time today, Marie-France.
Thank you.